welcome you to the session She Acts, Women, Water and COVID-19, Strengthening Women's Voices. My name is Fanny Zentay and I'm working in GIZ's sectoral program Water Policy as an advisor on good water governance and gender. Before we dive into today's topic, I would like to mention some logistical and technical information regarding our session. So first of all, the session will be recorded, which will be made available after the session. So with your participation, you automatically grant the recording permission. And if you don't want to be recorded, you would now unfortunately have to leave the session. But we of course all hope that you will bear with us. In general, I would also like to kindly ask you to turn off your camera during the whole session and also mute yourself whilst not speaking. If you have any questions, then please just post your questions in the chat box and also later on in the Q&A indicate which of the speakers you would prefer to answer your question. So that's it also for the logistics side. Now coming to the topic of our discussion today. So in our session, the spotlight today will be on women. Women play a fundamental role in the wash sector, and especially when it comes to water provision and household water management. They are key to successfully achieve SDG 6 and the Agenda 2030 as a whole. Despite the pivotal role they play, women have to bear with long-standing gender inequalities. They are very often underrepresented in water management and excluded from policy planning and decision-making processes. As a consequence, their unique needs regarding accessing water and sanitation remain mostly unaccounted for, thereby depriving them of their basic human rights to water and sanitation. However, it is important to view women not only as victims, but as strong actors in their own right. Thus, the session aims to show that women are agents of change towards a better and more inclusive water management and governance, and are also active leaders and experts who come up with practical information and guidance, and also contribute to better development outcomes overall, particularly in the current COVID-19 crisis. So today, I'm delighted to introduce you to our four inspiring panelists who will not only shed light on the gender-related implications of COVID-19 in the context of wash and water resource management, but also showcase their bottom-up approaches and measures that women are taking, particularly at the local level, to manage the global pandemic. So at the end of the session, we all hope that you will be inspired by the multifaceted actions women are taking up worldwide. Having said that, the agenda of today is as follows. To make it more lively and interactive, we will have 2 rounds of Ignite speeches. So in the first round, we are welcoming Ms. Margaret Nakato, who is the founder and coordinator of the Katozi Women Development Trust, which is an Ugandan NGO aiming to empower women to engage in social, economic and political development processes. The second Ignite input will come from Kusum, and I'm hoping for the correct pronunciation, Atukorala, who is the chairperson of the Sri Lankan network of women women water professionals that promotes gender mainstreaming in the water sector through holistic water management. After a short Q&A, where you all may have the opportunity to directly engage with Margaret and Kusum, we're continuing with the second round of Ignite inputs, where we are very much excited to have Ms. Tanya Khan on board, who is the National Coordinator and Representative of the Water Supply and Sanitation Collaborative Council in Pakistan, which is a global multi-stakeholder membership and partnership organization that works with various organizations, governments, and local entrepreneurs to improve sanitation and hygiene at the scale. At the same time, Tanya is also the chair of the National Menstrual Hygiene Management Working Group in Pakistan. Last but not least, after Ms. Tanya Khan's contribution, the final Ignite input today will come from Diana Iskreva, who is the founder and the executive director of the Earth Forever Foundation, a well-established NGO based in Bulgaria, which specializes in water and sustainable sanitation management at national and international level. After these 2 inputs, we have one final round of Q&A where you may refer your questions to Tanya and Diana. Afterwards, we are closing our session with a short wrap-up and provide you with a brief outlook. This will be done by Ms. Lesha Wittmer, who is a highly experienced independent global expert on water governance, working on both at the global UN level and at the grassroots level. At the same time, she's also the steering committee member and advocacy lead of the Women for Water Partnership. And last but not least, Lesha will also do the main moderation of the session. So without further ado, I'm now excited to hand over to Margaret, and I'm looking forward to your inputs and the fruitful discussions afterwards. So Margaret, the stage is yours. I will just share the presentation. 1 second. And I hope it works. And let me know if you can see something. And if it takes too much, yes?
Not yet.
If it takes too much time, I will just share rather my screen and it's easier. Yes.
Margolada, could you shut down your video, please?
One moment. I'm opening the presentation and just sharing then the screen. And then I hope you can see everything. So, let me know if you can see everything.
Yes, Fanny, it's getting there.
Perfect.
All right.
Great. And the floor is yours, Margaret.
Thank you, Fanny, for the introduction. And hello world, thank you everyone for joining us on this discussion on the role of women to strengthen access to water and their intervention on COVID. I'm coming to you with a lot of baggage as I have a cousin who is fighting for his life in the intensive care. But nevertheless, the coronavirus pandemic has highlighted the importance of access to safe water, yet the water and environment sector remains underfunded by the Uganda government. I work with women in fishing communities north of Lake Victoria. Fanny, next. I work with women in the fishing communities north of Lake Victoria in Uganda. And at the outbreak of COVID-19, the situation was still there in fishing communities that are characterized by lack of access to clean, safe water, with many still depending on water from the lake and other open sources. The outbreak of COVID is also happening at the backdrop of rising water levels in all the lakes in Uganda. This has resulted in flooding and displacement of fisher communities, loss of livelihoods. Additionally, the rising water has submerged water sources and latrines in communities that still depend on water from the lakes. The risks to outbreak of water-related diseases such as cholera are very, very high. Next, Fanny. We all know that we are making progress towards increasing access to water by the state and non-state actors. But despite this progress made, access to clean water, sanitation, and improvement of hygiene, promoting nature-based solutions, such as using biosand filters, dry toilets, the situation is still wanting for rural communities that are depending on communal water points. There is crowding during collection of water in all the rural communities, increasing the risk of spread of COVID-19. The outbreak of COVID-19 demands prioritization of water, sanitation, and hygiene in national budgets allocation to increase access to water, functionality of all water points, and affordability of water for all. Next, Fanny.
Sorry, Fanny, can I just intervene briefly? You're not in presentation mode. Can you enter full screen? Sorry to interrupt.
No worries. 1 second. So what shall I do now? Sorry. I thought I had full screen. No?
Did you not share the PowerPoint presentation? You shared your screen?
Yes, because it was too slow with the PowerPoint uploading. So I just shared the screen.
Okay, can you try sharing the screen and putting it in full screen mode?
Okay, then 1 second. Okay. I'm just clicking on desktop, correct? And that's it.
Yes, and then go into full screen mode on the PowerPoint.
I thought it was, I can go on Bildschirmpräsentation, it's easier.
Yes.
Yeah. Okay, perfect. Thanks.
There you go.
1 moment.
Sorry, everybody.
No worries. Thanks for the remark. So Margaret, this was the last slide, the next one, right?
Yes, Fanny, but I cannot see your slides. I cannot see your screen.
I hope now you can see it. Can you see something, Margaret?
Not yet.
I can see it, Fanny, and I think Nina is seeing it as well.
Okay.
I can see it as well.
Okay. Then it seems to be another problem.
Maybe perhaps Margaret can briefly leave the call and then re-enter. Sometimes Teams has this bug.
No. Margaret, just keep going.
Okay. All right.
Use your own screen and keep going.
All right. So, despite all these challenges that are currently in these communities, women have played a greater role in increasing access to water, sanitation, and improvement of hygiene, including awareness and messages on COVID-19. Building women's capacity has been crucial for KWDT to strengthen women engagement in governance of water and sanitation. Capacity development of women has enabled women to contribute to scaling up access to water through construction of rainwater harvesting tanks, sustainability of to sustain functionality of the water points as women are working as hand pump mechanics. They've been trained to do that. And they do a lot of awareness campaigns in fishing communities to promote good hygiene practices. These are interventions that strengthen women's voices in the sector. Our key strategy has, next please.
It's there, Margaret, keep going.
So our key strategy as KWDT has been to explore on building collaboration with local leaders to ensure that local leaders can work effectively with the women who are occupying new roles and responsibilities. We have strengthened to women to work in networks. For example, the women hand pump mechanics, we have connected them to a network of hand pump mechanics where they can have their voices in the network. And we strengthen their voices in the grassroots communities by ensuring that if we have a community dialogue, women are actually the ones who are mobilizing the communities to be able to attend such dialogues, strengthening women's voices in increasing access to water, sanitation, and improvement of hygiene. In many of these grassroots community forum, it's been the first opportunity for many of the grassroots communities to be able to meet their local leaders. So it has somehow created a forum where local communities can be able to meet with their local leaders and to demand accountability from their leaders. So all these initiatives have been spearheaded by women. It's unfortunate I'm missing the slide on COVID intervention. I don't know whether Fanny, you can be able to do anything about that. But as we wait for that to happen, is that for women to be able to intervene or to do anything on COVID, it's been through KWDT having been able to organize them. And when you organize them, we have also been able to build their capacity to be able to influence and mobilize communities. And they have earned the trust of the rural and privileged communities as champions of water, sanitation, and hygiene. At the outbreak of COVID-19, women championed awareness campaigns in rural isolated communities, particularly reaching children who are out of school and excluded to access communication messages on preventive measures against COVID-19, where all the messages are disseminated with the use of radio or telephone or TV, yet most of these communities are lacking these communication medias. So the intervention of women has influenced change of behavior, as you would have seen in the slide, where everyone, even children, are aware that we need now to wear masks. We need now to hand wash our hands every now and then to be able to control the spread of COVID-19. And other than just sending out the messages in the community, the women have also been very influential in monitoring what are the community's responses when they receive these messages. Is this something they can be able to change from their norm and do something new so as they can be able to protect themselves? So they have also been able to do that. And other than that, we working in the rural poor communities, so KWDT has also been very influential in ensuring that how do we enhance these communities to be able to access soap all the time, which has proved to be an essential product to be able to curb the spread of COVID. We have supported the women in making of soap locally and also in the production of masks. And all these have been initiatives which have been carried on by women, strengthening their role in communities that are unprivileged and marginalized, to ensure that they actually adhere to standard operating procedures, including ensuring that they can continue to access water, where many of the communities are actually failing to pay user fees because they are out of employment due to the lockdown which the country has been experiencing. So the women's role has been significant in this moment, and the pandemic has not only magnified the shortcomings of the WASH, but it has also it has put a magnifying lens on the role a woman has to do in water sector, including addressing such pandemics. So it is very, very important as a way forward, what this pandemic is telling us, that we need to increase investment in access to water for all. We need to ensure that actually women are engaged or are given the opportunity to engage in governance of water. And for them to be able to do it, we need to do skills development. And we also need to do deliberate efforts to make sure that we engage and allow women to join networks where they can enrich their experience and improve on what they are doing through being members of those networks. Thank you. Lisha,
Yes, please.
can you hear me?
Yes, I can hear you.
Right.
Lesha, are you taking up the question?
No, we first go to Kusum and then we'll go to the question.
One second, I'm uploading again. One moment. So,
If you want, Fanny, I can also share my screen, so you don't need to worry about it. Ah, no, okay, it's fine.
now it works. But otherwise, yes, thanks. So, Kusum, the virtual stage is yours.
Hello. Hello.
We can
We
hear
hear
you,
you,
Kusum.
Kusum. Get going.
Okay. Thank you, ladies and gentlemen, water warriors all. I'm so glad to be with you, though nobody can see me because I'm in a dark room and there's nothing I can do about it right now. So when I talk about She Acts, I take my mind back to Dublin Rio principles. Dublin Rio principles, especially two. One is, which we all know, is emphasizing the role of women in water management. But the second one, which I think is very important in this time of Corona, is decision making at the lowest possible level. In Sri Lanka, where I'm right now, we had a very hard lockdown. But we had very few casualties, and we are opening up. Right now, we are also having schools opening up little by little, and by September, they would be open. And one of the people that I work with, who is a school principal, called me and said, we have been told to have one tap per 50 children. I don't have the money and we don't have the water. And this, I think, is the basic problem when it comes to Corona, the COVID virus. Now, if we think that hand washing is one of the most important things to safeguard ourselves, our communities, our schools, we need to have water. But we are having a situations, not only in Sri Lanka, but in many other parts of the world, where the water security is fast turning into water insecurity. I'm sorry if I'm shouting, I'm trying to overshout the wedding on the other side of the wall. So please bear with me. I think that if we have we, in a sense, because of the pandemic, we have fallen from the frying pan into the fire. It is children and women who play, well, I would say most of the time carry water, which means it is children and women who are most of the time being exposed to the possibility of infection. I think that to a certain extent, I think that I feel very frustrated because most of the time we are doing things on the ground. And now it is only now that we have a situation where we can at least start thinking of doing field programs. So what I feel that is, I want to go back to the Netwater mantra, which says awareness, advocacy, action. Action is limited for us at this point, but we can certainly build awareness and certainly do advocacy. But how do we do awareness and advocacy when we cannot meet people? It's very nice to have Zoom. It is very nice to have internet, but very often, most people in parts of the world do not have access to the internet. So we are facing the digital divide, and our capacity building programs cannot be totally ICT dependent, because we simply do not have laptops, we don't have tablets, we don't even have smartphones. Many of us do, but there is lots of poor women, poor men, poor children who do not have access to these devices. So how do we take the message of building safety for communities and also building awareness about what should be done? How do we take the message of the basics, that catchment conservation is what we need to go for if we are trying to have a stronger wash programs? Because more and more the taps are there, but the water isn't there. So I think, Lesha, do I have 1 minute left? No. So
Yes.
I think it is not only for developing countries, because I read last week that 10 million students in the USA also are digitally deprived. So as much as we think that we are able to access, and accessing to build awareness is the first step towards action, we have to find a way out. When she acts, when women act, when we are strengthening women's voices, we also have to look at the means of communication and devising means of communication in this very dangerous situation. Thankfully, we are not having as many infection as some other countries. I'm so sorry for them, and we can start face-to-face programs next month. But nevertheless, the issue is that we have a situation where we must take decision making back to the ground level, and we need to be very creative in how we do that. So for me personally, this kind of interaction is rather frustrating. So I'm looking forward to the time that we can go beyond being laptop warriors to boots on the ground. Thank you.
Okay, ladies, thank you very much, both Margaret and Kusum, for sharing the, I would say, the problems on the ground. I take two really important messages from this. One is that the communication should not only be ICT dependent. I've seen other presentations of Margaret where they're heavily relying on people going on motorcycles to local communities to bring the message. I've seen wonderful examples from Kusum where they translated a lot of the information into the local language, and nobody's willing to print because you can do everything online, and of course that's not the case. Just be aware, all of you, that 58% of the world population has no access at all to mobile phones or internet. So we have to look at other issues. I think there's two questions that jumped out at me. One is to Margaret. Could you explain a little bit more about the type of training, type of capacity development you did with the women in the fishery villages? So maybe I give the floor to Margaret first.
Lisha, and our listeners from the world, the type of trainings that we give to the women are diverse, because our work as KWDT is to make sure that we position women places where they can be able to drive development. So we have to, and we are only able to do that when we bring women together. We make a deliberate effort to make sure that we organize women in groups. That's when we can be able to reach them this training. So the trainings begin from how they can work together as a group, how they can do leadership, how they can manage conflict, how they can facilitate WASH trainings in the communities, how they can be able to monitor, including skills development, like construction of our water facilities, repairing well in case it lobbying, and how can they enter income generating activities that are going to be able to respond to WASH, like soap production of masks, purifying water. So all these are areas, they are so broad and diverse, and they're all in the arena of the woman, that actually when you empower her with those skills, you not only change her quality at the household, but she can also be able to influence.
Okay, Margaret, can I summarize by saying that there's lots of very, very good local activities done by women that are not supported enough. We're going to import them from God knows where, although our local women are actually manufacturing it. So why are we supporting them? Yeah, and loads of other issues there. But I think that's something to discuss further and elaborate on further. There were, I think, a few questions in terms of clarifications. So what can we do to ensure that the voice of the women reaches the policymakers? Kusum, are you there?
Oh,
yes, please.
Yeah, I think again, sometimes we tend to downplay the role played by politicians and policymakers. For me, it is a measure, the only thing which works is to build awareness, to engage with them. And there sometimes we need to have situations which are non-threatening, especially if you come from a conservative background, as does most of Asia. You know, when you talk about gender issues, there is a kind of a stepping back. There is a kind of a threat. You know, are you being against our culture? Are you trying to do something which is Western oriented? So we need to have a period of engagement where we show them through our work that we are engaging to improve the status of women, which is beneficial for the entire country. It takes a lot of time. There are people coming from different backgrounds, but so a period of engagement, showing, giving examples of awareness and advocacy is what leads to action.
Okay, thank you, Kusum. Fanny, I'm going to hand over back to you for the next two speakers.
Yes, exactly. Thank you so much, Lesha. I think I would like to ask, the question is, Tanya, could you share also your screen? I'll rather wait and start with Diana. Otherwise, we just start with Diana.
I've shared with you the presentation, so if you could just upload it. But I will just start by saying that in Pakistan, as you can see, I hope everyone can hear me. Can you all hear me?
Yes, we can hear you.
Go ahead, and everybody who is not speaking, shut down your video and shut down your microphone, because I hear backgrounds from different parts of the world. Okay.
Can you hear me? Yeah, Fanny, have you got my presentation?
Unfortunately, I have not received your presentation, no.
Well, I've emailed it, so if you can just see, it'll be with you in a few minutes. It's with me, I CC'd myself. So I'll just go ahead.
Okay, I tell you as soon as it arrives.
Okay, so I think it's there because it's with me as well. So I've BCC'd myself, so it's there. So anyway,
yes.
Okay, so anyways, I'll just first of all thank you for GIZ for giving us this opportunity for presenting this very critical issue of under COVID-19 and WASH and the role of the woman in this sector. So as you can see that in Pakistan, we had Pakistan is one of the countries which was very intense, which had really intense, the COVID-19 had affected it badly in the initial months especially. And for us in the WASH sector, I mean, because everyone was unprepared, so nobody knew what was happening. So what was most critical was for the sector to come together and help and be part of the coordination mechanism, So that was very critical. And if you see the statistics, Fanny, if you can show the next slide. If you see the statistics, I mean, we have, we have very low indicators when it comes to, WASH sector and the health indicators, especially in terms of stunting, diarrhea, mortality, morbidity already. So when COVID-19 hit us, it was actually a much more intense, impact. Next, please. Can you change the slide, Fanny? Yeah. So, I mean, for sector to come together, it was very critical. And initially, as you all said, that we were all using Zoom facility to get connected. And the sector got, in fact, I was one of the pioneer person to suggest that we all need to get, rather than, sitting and waiting and losing on time, we need to get together and strategize, and especially, who's doing what and where. So that was well taken by the ministry and other development partners. And then the first thing that came in was the IPC package for the health facilities, for isolation and quarantine centers. And, there were very, limited WASH facilities in the isolation centers, quarantine centers, and very menstrual hygiene management was next to minimal. There was no, neither sensitization or awareness about those things as well. So the sector put together the IPC package, which was used in the health facilities and the isolation and quarantine centers. And then, of course, the preventive measures, the community, which, we have been reaching out in the past with messages of hand washing and hygiene and water safety measures. But with COVID-19, that had to be enhanced. And a lot of community outreach and mass communication, because we could not do face-to-face interaction. So mass communication through the, mobile phones, through loudspeakers, through, other means of communication that were there. But then at a later stage in June onwards, we started having face-to-face sessions, especially looking at the SOPs and having smaller groups. So there were field teams, there. And most critical was the health workers. So we see the lady health workers, which are the frontline workers, very critical for reaching out in their neighborhood with mass messages. So capacity building was very critical. The sector, the government departments, the development partners, we were not trained, to respond in this way, So that is something, a lot of advocacy, high-level advocacy, the engagement of the Prime Minister, the Chief Ministers and other ministers were very much there. And the role of women was very critical because, when it comes to the household level, the woman plays a very critical role. So efforts, we still feel that, the frontline workers, the efforts were made to reach out to them. And even now we are proposing that since now the lockdown has eased, we need to enhance.
Yeah, 1 minute left.
Okay, can you go ahead, please? Next slide.
Yes.
Fanny, can you move the slides?
Yes, I'm trying. It just takes some time.
So, I mean, ahead are just the pictures, and I would like to come to the way forward.
Yeah, I'm just facing some technical issues.
So, I mean, I would go ahead with the way forward. The way forward for us that we feel is that, yes, we need to especially make sure that vulnerable population is reached out. So the sector needs to prioritize. These are some of the examples. So if you come to the last slide, because I have 1 minute left. So, I mean, if Fanny, can you move to the last slide, please?
I am with the last slide. That's the way forward, I think.
Yeah, but I'm seeing the female staff. Yeah. So, I mean, we need to prioritize the outreach to vulnerable segment of the society that we have understood that was very much needed, because it's easier to reach to the nearby areas, but far-flung areas, and especially getting the government and development partners to adapt the principles of equality and non-discrimination in their response plan, with critical capacity building, as I've mentioned, of frontline workers and government departments, sector coordination, and then accountability for access to services. That is very critical, that we need to establish accountability mechanism for the service providers to be accountable for the services, as well as those who are taking access to it. I think there's a last that I can't see. Yeah, intersectoral approach, because water, sanitation and hygiene is not one department or one sector's issue. All the other sectors, you know, we feel that need to come together: health, education, local government, public health, as well as, you know, our other, you know, departments and ministries, related ministries. So that is something that we need to encourage and enhance on. These are some of the pictures of the hand washing stations that were placed in the public places, and how communities were encouraged to work on, I mean, prioritize this issue. And then, of course, the product soap was again a critical area that needed focus on. I think my time is up.
Thank you very much. I think, Fanny, the next one is Diana.
Exactly. Last but not least, Diana, 1 second. I'm also sharing my screen again.
Thank you very much for inviting me to make a presentation on a project that we implemented in Bulgaria. The name of the project is WeWash, Women Empowerment Through Water, Sanitation and Health. This is a project that was implemented before the COVID pandemic, but actually it addresses it, as it addresses better, safer sanitation, hygiene for better health of the communities, households and persons. Next, please.
Jan, yes, I'm trying.
The goal of this project was to empower women through meaningful, equitable involvement in decision-making, development of skills, and starting small businesses in alternative sanitation sector. Women and girls from rural areas were able to improve their capacity to apply bottom-up approach and strengthen the enforcement of Bulgarian legislation. The target group of this project were jobless and poor women and girls from 3 rural communities in central Bulgaria. Next, please. Here, next slide, please. Yes, here you can see some of the participants. Actually, it was not just focused on specific people, but it was focused on the community. It was involving the community. Next slide, please. We made a special photo exhibition in the community center showing the portraits of all the women that were very actively involved in this project. which was something new that we did to personalize really the effort and the participants. Next, please. Through this project, we did lots of activities. I want to focus now your attention on this part of the project that was doing with learning by doing. We were tackling a number of issues. This is biological waste, how to handle it safely, composting, safe reuse to improve soil fertility. The other subject was safe use and management of plastic wastes, which is a real pandemic in Bulgarian villages and not only. Then management of stormwater, floods, and through this we also emphasized every time on the empowerment of women to stand for their fundamental human rights to safe drinking water and sanitation. Next slide, please. The women were trained practically to build modern sanitation systems, as we built together one system in the daycare center for children in one of the villages and one of the churches that is built at the moment. We did renovation of the sanitation system in the community center also in one of the villages. Specific vocational training in water and sanitation management, also in repair of water system. I mean plumber skills. Sorry, I hear some very loud noise. Probably everybody hears this noise. We trained women in laying of tiles.
Please shut down their microphones and their videos, except for Diana and me and Fanny.
And we managed to involve also in these activities girls and boys from the construction high school in our city, who were also involved and who helped the women to improve their skills. One of the very exciting things that we were able to do was coaching of women and girls to start money-making initiatives and apply the skills that they acquired through the implementation of the project. Next slide, please. These pictures are showing some of the activities, some of the possibilities that were given to women. You see, there was no restriction of age, there was no restriction of ethnic involvement. We have Bulgarian and Roma women and girls involved. We had also we had activities that are very much like manual activities. At the same time, we had also the opportunity of these people to participate in conference, in the school conference, in the school of construction. Also in international events, the Youth European Parliament, where they were able to present their activities during the during this project implementation. And next slide, please. I believe women were proud, and they were mostly proud because they themselves took participation with their hands, with their decisions in creation of these beautiful and very hygienic sanitation places that they were lacking before. These are toilets, but not only. As you see, there are also filters, planted filters for wastewater treatment. So actually we close the cycle that guarantees safe sanitation and safe treatment of waste. The next slide, please. The final slide is showing our forward message. And we believe where government, like in the case of Bulgarian government, is unable solely to enforce the national legislation on wastewater treatment, it is crucial to empower women to apply bottom-up alternative solutions in wastewater treatment for households and communities, as in the same time improve health status and safe food supply for their families. Thank you very much for your attention.
Thank you very, very much, Diana. I think you did a wonderful project in Bulgaria, and I hope we can duplicate that in other places in the world. Margaret requested that she could respond to an earlier question again. So Margaret, you have the floor to quickly respond to that.
Lisha, it was on the question that was raised posed to Kusum, which was about how women can be able to influence policies. And I wanted to make a small addition or initiative on what we are doing. What we are doing as KDAP to make sure that actually women's voice, or the women, they can be able to influence and inform leaders and policy, is to also unpack the information. Because when we have this information, like 65% of the rural population have water, that information women cannot relate very easily with it. But when we do the unpacking and when we try to put that into real life, then they can be able to understand what that means, and then they can check whether that's a reality, whether or it's not. The other thing we do is to make sure that we support women to do the lobbying and advocacy, and what needs to be done if they have to do the lobbying, like collecting evidence to support their information. And lastly is that networks have proved to be a voice for the women through which they can channel their information. For us, being members of the Women for Water Partnership, the Uganda Water and Sanitation NGO, we've been able to inform on issues that are affecting fishing communities and women. I think those are the few things I wanted to add.
Thank you very much, Margaret, and also for being such a very, very active of our Women for Water Partnership. You're one of our champions, absolutely, totally. I would like to go to a question to Diana, which I interpreted from the chat box. What is the difference in the input you got from the young women compared to the other generations? Is there a difference? And if so, what's the difference?
I never thought about it actually, because we never divided the women into young women and old women. I mean, on age level. We saw equal involvement from both men, young and old, but young women also had more opportunities actually. Maybe because the project was structured like this, we were able to support them even to go to international level and share their issues and to look for solutions. While I mean young, when I say young, it is something like 20 years old, because we had this opportunity. Otherwise, for the other skills, for example, we were expecting that when we make these photo exhibitions, maybe old, even old, not elder, but old women will be more reluctant to participate. It was not the case. They were equally eager to show their face, to show that they are involved, and that they demand empowerment, and they demand decent life. That they, they stand for their right for decent life. So I did not see really difference.
Okay.
So among the Roma population in Bulgaria, this is something very specific. we have girls, many girls, unfortunately, that become mothers at 12, 13. So some of the mothers, some of the mothers are actually children. And when they give birth at 15, 16 already to their first child, then they start thinking about vocational training, because they face the reality that without decent earning of salary, they could not really support their children and themselves. So we had also such women who were eager to participate in vocational training and be trained, for example, how to lay tiles, which is something that is well paid. And at the labor market in Bulgaria at the moment, there is a niche, a demand.
Oh wow! Oh wow, Diana. I mean, I get two messages from this. One is we should not discriminate in age, and one is we really need to, and I think that came out of the previous session as well, talk to the TVET sector to make sure that women, younger or older, get training and get jobs that can actually help in terms of being plumbers, carpenters, whatever profession. That is not the usual idea when it comes to women, but it's absolutely totally necessary. So yes, so last question, I think, because we're almost at the end of our session. Tanya, is there any response you want to give to what you saw passing by? You have to unmute yourself. Unmute yourself.
Thanks. Well, I think the other three presenters also, it was a great learning experience to see that how all of these in their different settings, you know, from whatever limited resources that were there, managed to, you know, make a big dent, especially in terms of addressing the issues, and then giving opportunities to women at different, you know, levels, may they be the grassroots or the, you know, at the other level, giving them opportunities to come forward and influence and make a change. So that's remarkable. And I think these kind of experiences, if they are exchanged and others can get motivation, because it's easier said than done, because when we look at our rural communities, the women have not experienced that kind of, you know, opportunity. So there's always like shyness and resistance, and you need to make more effort to reach out to them. So when we say reaching out to vulnerable women and vulnerable segment of the society, a lot of, you know, your behavior change communication package needs to be very intense, and making sure that there is reinforcement and giving them enough space and opportunity to play a critical role as a player in the sector.
Two more things before I hand back again to Fanny. One is that Diana would like to answer the question on the storm and flood management. Diana, go ahead.
Thank you very much. In one of the villages that we worked, it is a mountainous village, and they had lots of problems with storm water that destroys the streets, and even floods some of the houses that are in the lower part near the stream. So one of us, we talked about age. One of the women that is 87 years old, actually, she played the most significant part for this community. It was her effort for years to make the municipal government, the local government, to repair their street that was fully destroyed by storm water. And with the support of the project and her persistence, being able to visit the mayor, again at the municipal mayor, again and again and again, really, she was able also to convince the mayor, empowered by these activities. She believed that she has the right to insist that the mayor goes and sees by person what is the situation in their street. Unsurprisingly for everybody, the local municipality did the street. They even cemented it, which makes it more strong, more resistant to storm water than asphalt. So even very old women, very old people, but with their persistence, yes, and their intelligence,
Diana.
they can make a significant change, and they can give good examples to young people who she doesn't have a car. She can walk through this ditch that was made on their street. But the people that are on her street, there was one medical doctor, one architect have a house there. They did not believe that it could happen and that the municipality will ever give money for a small street in a village.
You just made the point, Diana. And as the last respondent, I'll give the floor to Kusum, who would like to also follow up on the age issue and advocacy.
Yeah, I think that I'd like to say that, the means of communication and the modes of communication has to change sometimes, because now next month, untrammeled by the COVID constraints, I'm happy to be starting off a digital mapping of a district where we get young people who are very e-savvy. They all have smartphones. They may not all use it for wash issues, but they do have the phones, to do a mapping of the hotspots, the water security issues of that particular district. And we would be uploading it and giving them access to change it, to identify problems which are coming. So I think advocacy, building awareness will lead to this kind of ongoing advocacy, because people can see this on their smartphones. The younger people can mostly. But still for lots of our maybe countries in Asia which have a high degree of literacy, the printed word is very respected, and books are usually not thrown away. Thank you.
Okay, Kusum, thank you very much. And I think you stressed this point rightly so before. Let's not only depend on ICT, virtual means, but also on this nice piece of paper that you can hold in your hands and reference back every time. And Fanny, I think it's something we still need to discuss to go forward.
Yes.
Having said that, my dearest Fanny, can you please, after I acknowledged all your efforts to bring this session together and being a supporter of all of us, to speak the final words.
Yes, thank you so much, Lesha. To be honest, I see also the time, so we're a bit running out of time, but I think you mentioned already the most important points. We'll definitely continue working on that together, jointly. And really from my side, a big thanks to Tanya, Kusum, Diana, and Margaret, and of course Lesha for the moderation. Thank you for all of you for sharing your valuable examples and really inspirational inputs, and for really highlighting also this exceptional role of women they can play in managing the current crisis and how they aim for safeguarding SDG 6. Thank you so much to all of you for the great questions we had, and I'm encouraging you just to stay tuned for the next session, which will be water integrity and readiness.